Hello, everybody. This is Anne DeGheest, and it's Friday, August the 28th. This is the first video of Anne Insights. We're going to be talking about the epidemiology. Now, one of the wonderful participants to my videos, a person named Tim, who's an angel, has put together two documents or a PDF. One is a time index that tells you exactly what time I talk about different subjects for every video. And another one is a spreadsheet that is linked to every video in alphabetical orders of the different topics. So these videos are put in as a hyperlink if you look at the description of the video for every week. So it's a nice way for people to kind of go back to prior videos because I'm starting to do updates as opposed to redoing big review every time of the same thing. So if you really like the content, please go back to see some of the deep dive we did on vaccine and therapy and everything else. So let's talk about epidemiology. So good news for the US, you can see in orange, the US is continuously to go down. We've dropped to below 45,000 cases there. Brazil is still zigzagging, a little bit of a downward trend. And of course, India has now passed everybody else in the world. It's clearly on an upswing like everybody else. We'll talk about there's a second wave in Europe, and that's something that we need to keep an eye on so we don't have the same problem reopening too quickly there. I'm going to do a review of some of the issues that the World Health Organization had and lessons we need to learn, some school reopening knowledge we've got from Europe, which may be relevant. And then the CDC finally got its data back, and so they put together a new dashboard. Please also take a look at my second video on epidemiology, on clinical update. There's a lot of new information there that are pretty good. So world highest, we are 24.5 million cases. For some of you, the old timers, we used to talk about 1 million cases and we're getting excited. Now it's just stunning numbers. 833,000 deaths. At this rate, we're going to pass 1 million in the next coming weeks. US is leading the charge with 5.9 million cases. Brazil is still ahead, but I think India is going to pass Brazil in the coming weeks. There's a bit of a slowdown just because of the US is slowing down in the worldwide number of cases there. So that's kind of good news. The World Health Organization has put together this new dashboard, which shows kind of the dark area there where the number of cases are the steepest one, which of course is the US, Brazil. South America is really being a hotspot, and unfortunately India, all very high density population there. So we expected to pass 1 million deaths by the end of September is the forecast. Right now we're doing 5,000 deaths per day in the world. That's an astonishing number. Think about 9/11 was 3,000 deaths. We're having like multiple 9/11 per day. So on the kind of a bit of a good news side, the US now has dropped around 46,000 cases. India is now at 77,000, which was the highest of the US in the middle of July. Brazil is kind of toe-to-toe with us as far as number of cases. And then we really, after these three countries, we drop quickly to Peru and Mexico. In Peru and Mexico, there's some issues about the data there since they have such a high positive rate in the testing. That means they're under-testing and probably under-reporting the number of cases. So looking at the 7-day averaging of deaths so that we can smooth the curve, you can see there's a bit of a flattening and the downward trends probably leading of the US. South America and North America are kind of toe-to-toe in being the leading of the charge, but Asia is clearly climbing. So on the average, Brazil and US and India are around 900 people dying per day. Mexico is half that rate, around 500. So good news for the US, we dropped by roughly 9% versus last 5 days. India continued to accelerate. And Brazil is kind of the zigzag up and down there. It looks like a plateau, but the data is kind of moving a lot. So worldwide, this is a worry. Spain now has a second wave, which is not as high as the first wave. And that's really a big concern because there are a lot of people in Europe went on vacation in Spain and the Balkans, which are two hotspots. And then now they're bringing back the virus to the original country like Germany and Belgium is having a research there. And Argentina never slowed down. France, you can see, has another odd surge, and now they've mandated masks everywhere. So we need to really keep an eye on Europe and learn our lessons as they're reopening. Italy has a tiny upsurge, but nothing compared to what you see in France and Spain. Germany has a bit of also a swing there. Ukraine never really slowed down. South Korea is another concern. They were the first one. Everybody was saying how wonderful they were, and they're having mini outbreaks. India, as we discussed, never slowed down. Peru has, a bit of an upswing there. We have to see how the data there seems to be underreported. Chile seems to have controlled the outbreaks that they had there. And then we have countries like Indonesia that are growing. And Mexico seems to have peaked. So hopefully the data is reliable enough that we can keep an eye on that. So there was an interesting study of 194 countries. And what they tried to analyze is that was there a difference between the leadership of men versus women in the outcome of those countries. And there were around 19 female leaders, so roughly 10% of those countries. So it's a very big data set. And what they showed is that the female leaders had half the number of deaths on the average than the male-led countries. Of course, that's on a population-adjusted basis. And the analysis, which is pretty deep, you can take a look at the paper there, it's very analytical, is that the women leaders were more risk-averse and had more respect to the loss of life, so they had faster shutdown. They also communicated directly, and empathetically the truth, as opposed to kind of delaying, some of the bad news. And so as a result of that, there was a higher trust for the population to follow all the guidance in restrictions and wearing masks. So interesting data. We had talked about this a few months ago, that there were like 6 countries like Iceland and Germany and all of that had done some amazing work. But no, this was a massive study of 194 countries. So interesting perspective that is really transparency, empathy, and respect of life, and then the population follow in doing the restrictions. Looking at another interesting analysis there, which was the number of confirmed cases by the income. And this is on the worldwide cases. And it's really interesting because this disease has really hit the higher income populations there. Now, part of that is there's probably not enough testing in the low income. That's why we're underreporting it. But really, the fact that it hit Europe and the US, you can see, had a huge bias. Now, in the next few months, if it continues to spread in India and Bangladesh and all those countries, you're going to see some changes there. But it was clearly a disease of the wealthy. Second wave in Europe is worrisome. Let's analyze some of these graphics here. You can see the infection per million. There was a very big peak at the end of March. And now we have this re-peak, and it's not half the rate of what it was overall, but still on the upswing there. So we really want to really be careful about that. The Spain was really hit extremely hard. In fact, even had a higher mortality rate than Italy there. And this is really worrisome there. During the summer vacation in July and August, we had a lot of people coming from all over Europe going to the Spain beaches. And you can see there was a massive upswing there, which is at the level of the March. So that's very worrisome there. The good news, it's a younger population that got hit. It's the people who were traveling on vacation. So if you look at the brown versus the blue, the brown is a second wave, and you can see the majority were the young people who got infected, and that probably explains why the mortality rate is lower. And Switzerland is showing kind of the same thing, which is a beginning of infection there, but again low mortality rate. So I think it's a combination of a younger population. We now know how to take care of these patients better. We give them oxygen earlier. We give them blood thinners earlier. So, but it is worrisome that you can see the swing to be so high. So what does that mean for school? Remember, Europe is starting to reopen the school. An analysis in the UK showed that there were outbreaks, but there was not a direct link between the school reopening and the outbreaks. And so that, in fact, it was interesting. The number of cases, there were only 30 kids, but 91 staff. So that the people were really at the highest risk were the teachers and the people working in the schools as opposed to the students there. That's the UK story. And you can see the outbreak where the gray zone in the confirmed cases. So there's clearly not a direct correlation between the outbreaks in that region and the school reopening. On the other hand, the World Health Organization has just come out in the last few days saying that every 12 years and older kids should wear a mask. And that clearly transmission of that population is as high as the adult population, so that the classroom should have a mask. Germany is reopening next week with in-person classes, and they came to that conclusion after setting up new ventilation into the classroom. And then they create what's called cohort students, so they keep the class separates there, so this kind of smaller area there, so that there is less contact between all the different students. So China is reporting their reopening of the school next week is 300 million people that are between the students and the faculties there. They all have protective measures and shields and masks and everything else. So let's look at the World Health Organization. What went wrong there? The first thing is that if you look at their budget, there was very little spent on being prepared for any type of outbreak of pandemic. Pretty much most of the money is for the polio eradication there, which is supported by the US and the Bill Gates Foundation. So looking backwards at what went wrong, the World Health Organization has no authority to force countries to share data. And so what happened is that they cannot even send a team to China, which is what they tried to do in December, because they have to be invited officially by the government to send their experts. So the idea when the World Health Organization was started was that it will only be good faith cooperation, and it clearly doesn't work. The World Health Organization sent a team to China until the end of January. There was absolutely no cooperation. In fact, they found internal memo from the Chinese government ordering labs to destroy any samples and any information that could validate that there was a COVID outbreaks, which they've known since mid-December. So the other problem that they have is that there's 200 countries donating $2.4 billion in their budget. To give you an idea, that's a very small budget compared to what needs to be done worldwide. And pretty much less than 8% of the budget was going to pandemic preparedness. The majority of the budget is to eradicate polio, which was supported by the US and the Gates Foundation. So the other issue that surprised the health organization is that they're really focusing on helping developing countries. The assumption was made that the large, wealthier nations were prepared. They had infrastructure in place. And so when this thing hit there, nobody expected that the Europe and the US will be hit so badly there. So I think we need to revisit the fact that, this is just the focus should be for developing countries, that it really should be for all countries. The other issue they have is that they have to rely on outside experts to write a recommendation. To give you an idea, it took them 4 months to write a recommendation to say we should wear masks. And all of us figured that one out very quickly there in the process there. And during that period of 4 months, 500,000 people have died. So there's clearly some hard question, for the World Health Organization going forward there, and clearly need to get new treaties and new rules so that people are sharing information or allow the World Health Organization to come into the country to check things out. Let's look at the second wave. This is a new graphic that I found. You can see that New Zealand was, for example, was really low. They had like no cases for 100 days, and boom, they had that little outbreak we talked last week. South Korea, which was also doing great, now he's having a bit of an outbreak. These are the one we worry about. Spain, look at Spain. That's pretty much going back to the level they were. Italy is also climbing back, and Germany has also a spike. Now, the good news we talked about earlier, India, United States, and Brazil, are, kind of in a high level there. Remember, this is a logarithmic curve there, so we're taking a factor of 10x between the dotted lines there. But so it is confirmed that, we're having a second wave, and we need to learn from those waves before it hits the US. To give you an idea about how detailed some countries are, this is one of our participants shared with me the guidance done in the UK on people doing sailing races. And that gives you an analysis they have done of the activity you do on a boat. So this is much more detailed than when we do in the US, which is should we wear a mask or not? I mean, we need to go into the deep dive about what are the activity of all these different sports that could increase the risk of being exposed. So I just want to give you some example about how some of the European countries are some way ahead of us in being proactive. Let's look at the US, 5.9 million cases, 181,000 deaths. We're still climbing there. The slope is still slowing down, so that these are some good news there. If you remember the peak, we had 77,000. Now we're around 46,000 cases. We're still averaging around 1,000 deaths on the average there, so that hasn't had a huge impact. California is leading the charge. We're close to 700,000 cases, and Texas and Florida are just quickly behind us. So we have all passed, these 3 states have passed New York, which was hit the hardest in March. So good news, the data has returned to the CDC. If you remember, on July the 15th, the White House instructed all the hospitals to stop reporting their data to the CDC, and they had given a contract to a private operator called Taylor Tracking that was going to be under the supervision of HHS and the White House, and that became a mess. In a polite way of saying it, they were at least 1 week delay, inconsistency. 22 state attorney general basically demanded that the system reversed. So the good news, it reversed, and the CDC just announced a new dashboard, which they released, I think, sometime this week. And so I'm copying some of the dashboard there, 5.8 million cases, 180,000 deaths. And this is to give you an idea of the case rate per 100,000. I selected that graphic there because, California has higher population than Idaho, so it's not fair to look at the number of cases. But you can see that here, the Southeast is still having an outbreak because their cases is 3,000 in Louisiana, for example, per 100,000 there, which is higher than New York, some in the same way in Florida and Arizona. So you can see the whole Southeast there is kind of the area there where we're having still a lot of cases per 100,000. Testing overall is 9% positive. The target is 5%. There's a belief by the World Health Organization that if you have a positive rate of less than 5%, you can control the pandemic. And there are some states which are highlighted in red there, which is, again, the whole Southeast between Florida and Texas and Georgia, which are above 10%. So these are still areas there that we're under testing and still with the outbreak being still pretty active there, despite the fact we're slowing down overall. US dashboard, we have less cases, but we have less testing. And politically, there are some people in the White House leadership who says, less cases, less testing, less cases, it's good for everybody. And it does look like we're doing less type of testing, which is not what we want. The objective was to do 2 million per day, and we're still at 674,000 there, which just explains why we have some positive test rate of 8 to 9%, depending on data sets we're using there. There's a bit of a slowdown in the growth of the cases, but the question is that because we're testing less or because there's really a slowdown of the pandemic. This is a graphic we've been following for several weeks, and it really shows nicely that the Northeast, has slowed down. This used to be really red, so there's a bit of a slowdown in the growth, but it's still growing in the number of daily cases. So JP Morgan has a very interesting analysis there, and they look at the hotspots, which you can see all this days there versus the country as a whole. So on the country as a whole, you can see that decrease there. But if you look at the hotspots, it's still going up. So we still have several states that are in the growth phase. The good news is that their hospitalization is flattening there. So it's not like we have a huge taxation of the healthcare system in those states there, and mortality, the daily death rate seems to be stable there. If you look at the positive test rate, the number of daily tests, as you would expect, the areas that have the hotspots are still growing up in the number of testing, while the rest of the country has gone down in the number of testing. California is 690,000 cases, still growing tiny bit at 0.8%. Remember, there's that delay, so we still have an increase in the number of deaths. Unemployment, this was an interesting analysis there by the Department of Labor. And it shows, as you would expect, that the majority of the people who lost their job were in the low-wage area there. And the number is staggering. It's 34% of people having low wage, lost their job during that first phase of the outbreaks. And then medium wage was 11%, and high wage was 8%, which is pretty high. But clearly a strong relationship between unemployment and income. So this is the end of my first video. Please go take a look at the August 20th Clinical Insight. There's a lot of new updates there. And remember, we're going to be meeting again in 2 weeks.